So next up, I am delighted to introduce Anna Metzi. Is that the correct pronunciation? Mezzi. Anna Mezzi from Delta Dental. Anna is an account manager with Delta Dental, and she serves as a key contact for Acera for the account services that Delta Dental provides, and then includes implementing Delta wellness benefits programs and also servicing retiree members' requests. And Anna has over 20 years of experience in the insurance industry, and she's going to share some of her experience with us now. So take it away, Anna. Thanks for being here.
Hi, everyone. Thank you for having me. So today we're going to talk about oral health and how that impacts our bodies. Yes? You can't hear?
Okay, so thanks for pointing out that the slides weren't being shared. Okay. Here we go. Zoom. Let's see here. Share. Slideshow. Okay. Thanks, Anna.
Okay.
And there's no room mic, so you have to talk really.
Oh, okay. Very good. So for those of us that are in our 50s or older, our oral needs change as do our as we age. We're going to talk about the importance of good oral health and how Delta Dental can support you. Before we get into your group's specifics, I want to kick off with an important reminder. Delta Care, dental care is healthcare. Our organization's purpose is very important to us. You ask why? Because dental care can change lives. Dental care can save lives. In fact, dental care is often an entry point for people into the healthcare system. That's why we focus our efforts on three main pillars: access, quality, and value of care. I want to start with this visual that really showcases all the ways that our oral health can affect our overall health. Poor gum and health and tooth loss can increase your risk for a variety of chronic conditions and health issues, including those shown here. Gum disease is associated with an increased risk of preterm birth, as well as low birth weight and other pregnancy complications. Oral health can affect your mental health as well. Oral health issues such as untreated cavities and tooth loss may result in serious mental health issues, including depression, social anxiety, and low self-esteem. Our senior population is at a greater risk for many oral health issues, including gum disease. A recent study revealed that bacteria that can cause gum disease are also associated with the development of Alzheimer's and related dementia, especially vascular dementia. I highlight this because a dentist may be the only medical profession a person sees in a year. Dentists are often the first to detect serious health issues such as cancer, diabetes, heart and kidney disease. In fact, at least 90% of all systemic diseases have oral manifestations. Due to these connections, Delta Dental has been busy rolling out some critical partnerships and awareness studies that we'll talk about as we go through the presentation.
Adjust your camera.
Okay. Okay.
Great. There's no room amplification, so yeah. The mic is just for the online Zooming. There's no room amplification.
Sorry, I'll try to talk louder. Come over here. Come to the front. Up front, over here, so you can hear me better. Okay. Okay. All right. So as we move on, we're going to talk about how dental risks increase as you age. Cavities. According to the CDC, nearly a third of adults ages 20 to 44 have untreated tooth decay. To To make sure you're not one of them, visit your dentist for regular exams to catch cavities early. Brushing and flossing regularly are the best ways to prevent cavities from forming. Gum disease. If your gums bleed when you floss, you might have gum disease. Floss every day to improve your gum health and eat a diet. Oops, sorry about that. And eat a diet that's rich in vitamin C, which supports healthy gums. Dry mouth can be an annoying side effect of many medications. It can also be a natural result of aging. The purpose of saliva is to wash away food particles and harmful bacteria. So when you don't have enough saliva, you're at a higher risk of cavities and gum disease. Try to drink water throughout the day and chew sugar-free gum to help produce saliva. If dry mouth is still a problem, talk to your doctor or your dentist about artificial saliva products. Dental hygiene can decline as we age. One of the culprits is arthritis. If you or your loved ones find brushing or flossing uncomfortable, consider getting a special toothbrush with a larger handle. This can make it easier for you to hold. For flossing, you can try a Y-shaped floss holder, and these are available at most pharmacies. Good news is that studies show that seniors today are keeping more of their natural teeth than ever before because of better oral health care, home products, and services offered at the dental office. In 1965, half of adults age 65 and older had no natural teeth. Pretty significant. Today, about 75% of adults age 65 and older have most of their natural teeth, but many of those people do have the need for partial dentures or bridges. Even in the senior years, preventative care is still important for not only oral health, but overall health. So why get a dental exam? During an exam, the dentist will carefully look at your teeth, your mouth, and throat to identify any problems such as cavities, gum disease, loose fillings, and oral cancer. Your dentist may also notice signs of other health conditions such as acid reflux, osteoporosis, or kidney disease. Dozens of medical conditions have symptoms in the mouth. For some people, the dentist may be the doctor they see most often. If you have any medical conditions or are taking medications, let your dentist know. Some medications can cause dental side effects like dry mouth, oral sores, or sensitive gums. Overall, regular cleanings will reduce your risk of tooth decay, help you keep your teeth, because when plaque and tartar build up, you're more likely to develop gum disease and tooth decay. Removing this buildup regularly, and you're less likely to lose your teeth. A whiter smile. A cleaning removes everyday stains, giving you an immediately brighter smile. Improve your breath. Say goodbye to halitosis. The cleaning can get rid of smelly bacteria. And finally, it can support your overall health. Regular cleanings may help lower your risk for heart disease, diabetes, and other chronic conditions. As a Delta Dental member, you're eligible for several wellness programs that provide services to help improve not just your oral health, but your overall health. Member perks include access to virtual dentistry if you're enrolled in the PPO, Brush Smart, which provides savings on oral home healthcare products, hearing aids and LASIK corrective surgery. Discounts are also available. And Life Perks provide discounts on a variety of products and services and memberships and more. Wellness resources online such as, I'm really struggling with this. Wellness resources online such as articles, recipes, videos, and more. And not just on oral health, but overall health. As part of our wellness initiatives, Delta Dental partners with QualSight and Amplifon to provide discounts for hearing aids and LASIK eye surgery. By offering Amplifon and QualSight services, our hope is that members take better care of all aspects of their health. Don't worry, there's no heavy lifting required for groups or enrollees to use the discounts. Amplifon and QualSight each have a dedicated toll-free number to guide enrollees through the process. Savings to smile about. Our Perks program is actually a great program. I've actually used it myself. You get special offers and discounts on oral health, which includes access to discounts to keep your oral health on track, like electric toothbrushes and things like that. Health and wellness, you get deals on fitness equipment, gym memberships, and more. Lifestyle, you save big on services ranging from pet insurance, travel, and financial and auto services, and electronics as well. Travel and entertainment, keep the whole family entertained with discounted access to movie theaters, theme parks, concerts, vacation planning, and other travel services. Brush Smart. Members can sign up and take advantage of our Brush Smart program, which is an effective program that encourages better home dental care. Members who sign up receive personalized recommendations and special pricing from Philips Sonicare. Members can choose from a full range of oral care products for the whole family with free delivery to their homes. Each member who joins gets a first-time offer of 20% off from the Brush Smart store. Reducing bacteria, oral hygiene recommendations. We can talk about how we can best reduce total amount of and discourage the worst types of bacteria in our mouths. First, brush twice daily with a power toothbrush. Always choose a soft or extra soft brush head and use the more gentle setting on the power brush because your gum tissue is more fragile as you age. Also recommend watching the instructional videos that come with your electric toothbrush because different brands of brush clean in different ways. And the motion that you use when brushing with a power toothbrush is very different from motion you use with a handheld manual toothbrush. The next thing you can do is floss once a day. If string floss is a challenge for you, I recommend the pre-threader flossers that you see here in the blue packaging, or these gum brand soft picks. These are like gentle little toothpicks that you can slide all the way between your teeth or under a bridge to keep it clean. We also see great results from water or air flossers. Pro tip, for those of you flossing with a string or picks, start in the front of your mouth and work your way back because the most dangerous strains of bacteria live in the back of our mouth, in the pockets around your molars. So we don't want to spread those bad bugs that cause tooth decay and gum disease around your mouth or on your floss. Some recommendations if you have dry mouth that can help: sip water or high pH bottled water throughout the day and night. Avoid sucking on cough drops, mints, or candies. Try Xylamelts or saliva replacement products. Talk to your doctor about alternative medications if your dry mouth is medication related. A few things about gum disease. It is caused by a specific bacteria that has very distinct odor because this bacteria does not breathe air. They are anaerobic and live away from oxygen. You may recognize this odor because it smells like something died. It's really unpleasant. The other thing to note about bad gum bacteria is that it's transmissible in saliva, just like the bacteria that causes tooth decay. If you're noticing that distinct foul smell coming from you or a loved one, it should be an indicator to you that there may be some gum disease happening. There are several risk factors for gum disease, which include genetics, heart disease, diabetes, and rheumatoid arthritis. But the number one correlating factor is your age. So much that half of Americans over age 30 have gum disease, and over 70% of people over 65 have it. Those of you who are diabetic understand that wounds on your body are problematic for your diabetes. Not only do wounds heal more slowly in patients with diabetes, but when you have a wound on your body, it makes it very challenging to control your blood sugar levels. If you fall into the 22% of Americans with diabetes and periodontal disease, you get and you get gum disease, and you get your gum disease under control, you will see a dramatic improvement in your H1C and blood sugar levels, and reduce the likelihood of some of the permanent damage that can be caused by high blood pressure and sugar. This I found really interesting. A study of 100 pairs of identical twins in Sweden found that those with gum inflammation and periodontal disease early in life were 4 times more likely to develop Alzheimer's. Although more research is needed to understand the direct correlation between inflammation and Alzheimer's, it does confirm what dentists have known all along, that a healthy mouth contributes to a healthy mind and body. You can reduce your risk of gum disease and Alzheimer's by adopting these practices. Visit your dentist regularly for cleanings and gum exams. Get tips from your dentist or dental hygienist about how to improve your oral care program and regimen. Brush your teeth twice a day, floss daily, and eat a healthy, balanced diet, and avoid tobacco products. Menopause leads to changes throughout the entire body, including the mouth. Yet, most women are unaware of the connection between menopause and oral health. The majority of women surveyed don't know that menopause can increase the risk of dry mouth, gum disease, jawbone density, tooth loss and decay, and receding gum lines. Dry mouth and receding gum lines are the most frequently reported symptoms that women 50 and over have noticed since experiencing menopausal symptoms. You may not realize it, but your overall health and your oral health are inextricably connected. Take a look at the list of common health conditions that typically increase with age and the potential side effects that health conditions have on your oral health. You will notice that dry mouth is the most common of these due to the natural hormone changes that you undergo as you get older. The other major contributor to dry mouth are the medications, both prescription and over the counter, that we take. This list of medications is known for it's known for causing dry mouth as a side effect. So if you take any of these medications and you're experiencing dry mouth and can't get any relief from any, drinking water and any of the things that I've suggested here, always talk to your doctor about alternatives. SmileWay, the SmileWay Wellness Benefit offers enhanced coverage for higher risk enrolled members with any of the 14 qualifying medical conditions listed here. Delta Dental PPO enrollees can take advantage of expanded coverage if you've been diagnosed with the conditions listed on this slide. This approach supports integration of medical and oral health for overall health improvement, since the health of our teeth and gums is tied to overall healthy gums and teeth. Gum disease and tooth decay are associated with a number of systemic conditions, and enrollees with certain medical chronic conditions may benefit from additional teeth and gum cleanings. Members can self-report via their online account, and it's entirely confidential. Enrollees with qualifying medical conditions can opt in confidentially. Members can self-report via their online account, and it's entirely confidential again. Includes 100% coverage for 1 periodontal scaling and root planing, plus 100% coverage for 4 any combination of cleanings or periodontal maintenance. To learn more about your dental health, you can visit our wellness library, where there's hundreds of articles, dozens of short videos, tooth-friendly recipes, risk assessment tools, and interactive quizzes to check your risk level for cavities and gum disease. This site is also available in Spanish. Next, we're going to talk about our network and dentists and our providers. So it's important to note that ongoing challenges with the dental industry are not unique to Delta Dental. Staffing has been problematic. One thing nobody probably could have predicted after the pandemic is that many of us wouldn't come back when offices opened. A combination of factors has led to an unprecedented and ongoing dental staffing shortage. For reasons ranging from the fear of infection and family care issues to incompatible practice standards, assistants and hygienists hung up their scrubs. They went in search of flexible jobs, seeing many of their peers switch from office to home without a hiccup in their paycheck. Recent data from the American Dental Association shows that 35% of dentists gave a 4 to 6% raise to their employees, and yet 94.5% of them find recruiting a hygienist extremely or very challenging. So it's not even all about the money. And then geography plays into it as well. In certain areas of the country, patient volumes often exceed provider capacity. In 2022, the average patient to dentist ratio was 1,538 to 1. And in some places in the southern US, that ratio jumps to 20,000 to 1. Retirements or practices closing worsen the challenge, and this situation has created an access to care crisis, leaving people without dental care due to the shortage of dentists, especially in rural communities. And with dentists retiring, consolidating, or closing their practice, that only exacerbates the situation. Another factor is inflation. The US economy is being hit with double whammy of lingering supply chain issues, an extremely tight labor market, and inflation. The economic pressure is being felt across the country by individuals and industries, including dentistry and the healthcare sector overall. Inflation may result in more patients delaying care because they cannot pay for it up front. To continue to ensure we are meeting patient needs, we perform internal network analysis month over month and year over year by geography. In addition, we assess our network access against those of our competitors using both internal and third-party tools. Yeah, because it looks like
the share stopped for the people at home. So let me just reshare it. Stop share, reshare.
I also went to that delay, like the whole slide didn't pop up at once.
Oh, okay. Okay, is that okay?
Yeah,
to leave it like that?
Yeah, that's
Okay,
good. We can go to the next one. All right, thank you. Delta Dental continues to meet the challenges of maintaining one of the largest provider networks available in the industry. Here you can see some interesting facts based on providers treating ACERA retirees. So Delta Dental, in the time period of January 1st, 2024 through June 30th, 2024, Delta Dental enrollees visited 2,714 dentists nationwide. 3 network dentists who treated ACERA retirees left the network due to attrition. 4 network dentists who treated ACERA retirees went insurance independent. 1 network dentist who treated ACERA retirees was involuntarily terminated. And 2,952 newly added dentists are already treating Delta Dental members. 115 Delta Dental ACERA retirees and dependents have been affected by the dentist turnover. 80 were primary enrollees and 35 were dependents. Planning for the future. So provider tools, we continue to focus on digital engagement and adoption for a better experience. Our provider advisory council, we have 325 practices represented. You can't, no, they can't hear. Okay. You want to move up? There's seats up front. Recredentialing non-responder outreach. So we have found that providers can use non-compliance with recredentialing to silently quit. So we are attempting to retain them before they terminate involuntarily. We reach out to all providers that have active claims but are failing to comply with recredentialing. We provide a welcome back campaign where we continue to do a market fee alignment across all enterprise states, and we have a formal welcome back campaign to accompany this initiative. And then we have alternate payment models. In the beginning stages of evaluating, we might implement alternate models like value-based care, where we could recognize providers for quality and administration efficiencies. This is very standard on the medical side, but not prevalent in the dental industry. We don't lease any of our networks, which makes us different in the market. All contracts are direct with our dentists, which ensures predictable fees. We have consistent contract terms, which translates to consistent fees and processing policies. We have strong relationships with our providers, which ensures quality care. Our local staff members foster relationships directly with dentists and provide ongoing education to dental offices about processing policies and benefits. They also confirm whether any dentists have retired, if dentists reduce their workload, if dentists have moved. Fees limited to maximize. Another component of this is our fees, which we try to limit to maximize savings. No balance billing or unbundling. Dentists clearly understand which fee schedule to use for billing. No confusion with two separate contracts with two different carriers. And with us having a direct relationship with our providers, it provides for a more stable network and no disruption from termination of a lease network. If you or a family member needs to find a new dentist, we make it simple and easy to find nearby dentists and specialists via our provider portal, which is updated in real time. Members can simply search by dentist or practice name or by location. Members can use the filter options to refine their search. The Find a Dentist link is right on our homepage at the top. deltadentalins.com. You can go there and there's a find a dentist menu, and you can go in there and search for a dentist that's participating in one of our networks. Delta Dental is the first dental carrier that offers 2 independent third-party platforms for online dentist reviews and quality ratings. When finding a dentist, Delta Dental offers members 2 third-party platforms to help them choose: DentaQual and Yelp. DentaQual provides objective ratings based on quality of care. Yelp provides candid, unsolicited reviews and feedback from dentist patients to help members choose a dentist confidently. The DentaQual rating tool has become quite popular, with a click-through rate of about 900 a day.
Slides again. Sorry about that. I don't know what is going on with. Oh, I'll try. Yeah. I don't know what's going on with Zoom, but it just keeps losing the share. So I'll share. Then we'll get rid of this. And then let's see if I can move it to the top. Okay. Thanks.
Thank you. DentaQual uses claims data to rate dentists based on 5 criteria: treatment outcomes. Do procedures resolve patients' concerns with minimal post-treatment problems? Commitment to best practices. Does the dentist follow established dental best practices? Cost effectiveness. Does the dentist charge a reasonable rate for service? Patient retention. Do patients come back to the dentist after their first visit? And treatment recommendations. Does the dentist recommend similar treatments as other dentists in the area? Virtual dentistry. Dr. Daniel Crowley, which is our chief dental officer at Delta Dental, in his article titled Value of Teledentistry, discusses benefits of teledentistry in areas such as aftercare, second opinions, access to care, emergency care, and alleviating fear and stress related concerns with actually going to the dentist. Emergency room visits for preventable dental conditions are rising annually and cost taxpayers $2 billion each year. Having the ability to see a dentist online can prevent costly visits to the ER. Oftentimes, there is no dentist on call at the ER, and the patient is prescribed an opioid to numb the pain until they can see a dentist during regular office hours. This has led to overprescription of opioids. Virtual dentistry helps overcome these challenges that we see due to the ER visits. We believe that prompting virtual dentistry as an alternative to ER visits within your can greatly reduce costs and provide better care for those members. Delta Dental offers teledentistry tools that make getting dental care more convenient than ever. And these tools enable you to receive consultations from Delta Dental dentists on your computer or smart device. You're eligible if you have a Delta Dental PPO, Delta Dental Premier Plan, and I have 100% in-network coverage for oral evaluations. You're not eligible if you have a Delta Care plan, but you have the option to pay out of pocket for these services. That's it. If you have any questions, I'd love to answer them. Okay. Any questions? Yeah, so the question is if you're out of your service area and you need emergency dental care, is it covered and how is it covered? Yes, we will cover it. If you see a doctor participating in a Delta Dental plan and network, then yes, it works the same as if you were seeing your dentist. Go ahead. Oh, okay. Yeah. So it does. If as long as you see a network provider. If you don't see a network provider, because maybe there is not one available at the time you need the service, then you would pay for the service up front. And if you're in the PPO, you could submit and then you would get some form of reimbursement. Okay.
The other question I do, since beans and sprays, that's really
Mm-hmm.
is that it's annual.
You know, I'd have to look at, do you have the, if the x-rays and preventative apply to the annual maximum? I don't believe it does, but no. No, preventative care, if you go for preventative care, your cleanings, your x-rays, things like that, it does not apply towards the annual maximum on the plan.
The comment was that they've been told something different. What I do know is that the Board of Retirement approved that benefit 2 years ago for I think it was the plan year of 2022, but it could be 2023. that the preventative services did not count against the annual maximum. So if you're hearing something different, that might be a good conversation to have offline, and you can come up to one of us in the exhibit hall, or you could probably talk to Anna after the presentation, because that doesn't sound like it should be happening based on what the Board of Retirement approved a couple of years ago.
Yeah, if after this, if you want to come to the table, we have your benefits there, and I can take a look. Okay. It could be the dentist, and it could be, yes. Or if your plan runs it's a 2-1 to 131 as opposed to a full calendar year. So sometimes that may throw things off. So it may appear that you have met or have not met your annual maximum. So there could be a lot of different little nuances involved. Okay. But yeah, it should not apply to your diagnostic and preventative.
My dentist that I've been going to for a few years just told me that he's no longer accepting Delta Dental starting in January. And if I want to use his services, I pay up front and then submit a claim to Delta Dental. And I've been with Delta Dental since I started with the county, 40, 50 years ago. I mean, I hate the change. He's pretty good. What is being done to, I assume I'm not the only one impacted by that. What are our options? They told me of other insurance companies, but Delta Dental seems like the only one that's counting here.
So the question is, when your provider that you see is leaving the network, what are your options to continue coverage? So are you in the Delta Dental PPO plan? Can you, okay. Okay. So you can stay with your dentist. The PPO does provide an out-of-network benefit. So you will get some reimbursement. However, your out-of-pocket costs are going to be significant. Exactly, because we have no contract with that provider. We have no line of sight, and we're unable to manage what they can charge for a service or a procedure. So although the plan may cover a percentage of that, your starting point is going to be significantly higher because they're going to bill their full rate for their service. Yeah. Right. So you could look online and see another dentist, see if you like them, a participating dentist, and see if you want to stay in network and have that lower cost share. You could also explore other dentists in the network. But this is not unique just to Delta Dental. It is across the industry where dentists are becoming insurance independent. So it's not just Delta Dental. Yeah. And one thing, yeah, so the question is, or the comment was, you really need to do your due diligence to make sure that what the dentist is billing and who's paying is matching up, that the dentist isn't necessarily double dipping and asking you to pay for out of pocket for services that are covered by the plan. Mhm. So the comment is around explanation of benefits and not receiving them. So do you have an online, do you have an online account? Or, okay. You can do one of two things. If you sign up for an online account with Delta Dental, you can go in and view your claims. You can see what was submitted. You can see what the plan paid. You can see what your responsibility is. And then you can see overall, like where you are with your maximums, your annual maximum, things like that. You can also, right, you may have to opt in. I can double check. You may have to opt in for an explanation of benefits on paper. But I did see there are other members here that did have their explanation of benefits, their paper copies. Yeah, the comment is, to make sure that your dentist is aware of the fact that you know your benefits and you know what your plan covers. So my suggestion always is, especially if you're going to have a procedure that's going to be a little bit more expensive, get a pre-treatment estimate from your dentist. Always do that, because that way they have to lay it out for you, what they expect to do, how much they expect to charge, and what they expect the plan to pay. So at least you're going in with a baseline. Yes.
Did my research, and our is not part of the plan for the Delta USA plan. So I was just asking, since you are so knowledgeable, if there's any loopholes here, because I know that I got 2 of my 3 kids through orthodontia, and then I retired, and now the plan has changed, and it doesn't include orthodontia. So it means if I go with the USA plan, my whole family, has to relinquish our provider that we've had forever, right? In order for one child to finish an orthodontic process. So it sounds like I need to start saving my money, unless you can find if there's any loopholes that, partial coverage, whatever. Because I know there's always a back door sometimes.
The question is regarding changing from a PPO to the dental care program.
Yes.
The county has orthodontia in their plan, but Sarah has a separate plan, and we don't have orthodontia.
Yep.
And you retired, and then you switched to Sarah. That's right.
Yeah. So unfortunately, there is no loophole. My recommendation is, if you really want to minimize your out-of-pocket impact, is to enroll in the Delta Care plan. Get your child through their orthodontic, and next open enrollment, you can always switch back to the PPO. So that's kind of your loophole. But unfortunately, it's, keeping your dentist or lower out-of-pocket costs. Yeah.
Does Delta Dental have a process to encourage dentists who dropped out to rejoin?
Yes.
Can you
The question is, does Delta Dental have a process to encourage dentists that have dropped from the network to rejoin? Yes, we will continue to do outreach with those providers. And again, try to keep negotiating with them in good faith to get them back in the network. So yes, we do. Just because they dropped for whatever reason doesn't mean our relationship is over. We will continue to do outreach.
They no longer Delta Dental because they don't give enough money to go to them, so they drop out.
So the comment is that dentists have said that they have dropped Delta Dental because the reimbursement levels are not enough for them. And that's, yes, that is a comment that we hear frequently. From a Delta Dental perspective, we have to balance not only what we reimburse our providers, but also what our members need to pay out of pocket. So the more we pay our dentists, the more out-of-pocket costs will come to the members, the more employers will pay in premium. So it's a balance. It's a balance. And we do increase our reimbursements through the contract periods. However, we may not reimburse that dentist at the level that they want to be reimbursed at. So unfortunately, if we can't come to an agreement, they'll drop.
They will not-
Yes. The comment is if the dentist does drop, you can continue to see that dentist if you're in the PPO and still get an out-of-network benefit. My only caution with that is because we no longer have a contract with that dentist, they can charge whatever they want. And your reimbursement is going to be based off of a higher starting point than if you were to see a provider that is in the PPO or the Premier network. So that's always my caution, because yes, the plan will pay. And many times it's kind of a nominal amount compared to what the overall cost was.
Are Delta Dental dentists required to get a COVID vaccination before providing care?
Our providers mandated a COVID vaccine. I actually don't know that. I will have to get back to you on that. Are you writing them down?
They're being
recorded? Okay.
And, what's the difference between a PPO dentist and a Premier dentist regarding regarding the member benefits by going to either one?
Okay, what's the difference between PPO and Premier? They're both contracted with Delta Dental. The PPO has the most competitive fees, meaning that the dentist has agreed to take a lower fee, the lowest fee available within the PPO plan. The Premier dentist has also agreed to a discounted fee, but the discounts are not as deep as the PPO. So for instance, if the PPO dentist agrees to a 30% discount, the Premier dentist may have agreed to a 25% discount. So you're still starting at a lower number, and you're still in network, but there's a slight difference in the fees. And we do that because sometimes dentists don't want to take that most competitive fee. They want to participate, but they do want a little bit more reimbursement. So that's how we do it. You pay one premium. Oh, yes, I don't have it in front of me, but there's a schedule of benefits that will tell you the co-insurance amounts based if you're seeing a PPO dentist, a Premier, and out of network.
And let me just jump in and say that in the enrollment guide that you should have received in the mail, but if you haven't, it's in the mail. You'll probably receive it today or tomorrow or the next day. There is a chart that shows the differences between the PPO dentist, the Premier dentist, and the out-of-network dentist, and it shows you it explains what those three categories mean, and then it shows you the different coverages for each one. And if you all want to get an electronic version of that enrollment guide, all you need to do is go to acera.org/guide. That's acera.org/guide, and that will link you right to the PDF of the 32-page guide that you should be receiving in the mail.
I'm sorry, I'm not sure. So the Oh, okay. So the question is, what is the difference in the type in seeing providers between? I think you're asking between the Delta Care plan and the PPO, because the Delta Care plan requires that you select a dentist at enrollment, and all of your dental care is managed through your primary dentist. Under the PPO, you can see any licensed dentist you want. And within the PPO, you have essentially 3 tiers of coverage. The PPO provider, which is going to get you your most cost-effective services. The Premier, also discounted, not as much as the PPO. And then the out-of-network, which again is going to be based solely off of what that dentist decides to charge you. Okay.
Well, great. Well, I think that's all the time we have for questions, because we actually need to move on to the next presentation. So I just want to thank you, Anna, for being here.
Thanks,
and providing your expertise. Yeah, thank you so much.